Skin, the body's grandest organ, a silent sentinel making up 10 to 15% of your weight, stands as the first fortress against the outside world. This remarkable barrier shields us from many dangers, harmful bacteria, invasive organisms, and the relentless onslaught of environmental extremes. It's not just a protector, it's a regulator, maintaining our body's temperature through the cooling sweat and sweltering heat. It's a powerful sensory network, letting us experience the exquisite range of sensations, from pain and pressure to pleasure. Yet, this resilient armor has its vulnerabilities. The skin can fall prey to a host of afflictions, from the common agony of acne and the persistent itch of atopic dermatitis to the silvery scales of psoriasis, the discomfort of allergies, and the fiery torment of shingles. Add to these the burning sting of a sunburn, the insidious spread of skin fungal infections, the distress of hair loss, and the looming specter of skin cancer. In India, dermatologists often confront a landscape which is dotted with these battles. Acne strikes not only teenagers but also many adults, particularly women. Hair loss, suntans from relentless exposure, and fungal infections are widespread issues. A pressing issue in the Indian derma space is also the rampant misuse of topical steroids. These steroids make up over 80% of derma product sales, yet a staggering 95% of patients using them remain unaware of their adverse effects. Alarmingly, in some studies, 100% of users didn't know the correct dosage or frequency of application. Adding to this, a new and explosive trend has emerged in India: skin aesthetics. From non-invasive chemical peels and microdermabrasion to derma fillers and the household name Botox, the quest for beauty is booming, fueled by increased awareness and increased disposable income. The Indian aesthetic market, in fact, is projected to grow at a CAGR of 13.3% to over 13 billion by the end of this decade. Today, we delve into the crucial issue of skin health, particularly for those of us living in the tropical climate of India, where extreme heat and severe air pollution exacerbate skin problems. To guide us through this discussion, we have with us Dr. Sonali Kohli. Welcome to the show.
The barrier of the skin is lost because your steroid is thinning your skin, and over time it's also oversensitizing you to the skin. I recommend a double cleansing method, which is using a micellar water prior to your face wash.
Well, Dr. Kohli, let's start with you. What are some of the most common skin conditions which are faced by Indians?
I feel like that in my practice, I have seen an increased incidence of the occurrence of fungal infections. And as you rightly said, being in a tropical country, that has been one of the major factors which has been contributing to the increasing fungal infections. I also see there is a rise in cases of acne, hair loss, and pigmentation.
What is it in Indian patients which make them susceptible to fungal infections?
I think first and foremost would be the environment, because it's the climate that helps the fungus to grow because of the high humidity in our environment. However, having said that, there is also a lack of education, because a lot of these products which are available over the counter at pharmacies are actually triple combinations which are containing steroids. And with the increased usage of these creams, the new fungal strains that we are seeing are actually resistant to most treatment, which makes it very difficult as a dermatologist to treat these infections, because by the time the patient is coming to you, they've already used this plethora of wrong medication. So they are resistant to half the things that you're going to try with them. And secondly, I think because the pharmacological regulation in our country is not as strict, a lot of these drugs are available very easily. And patient compliance becomes an issue when they go to the doctor, because when you use a steroid, you see instant relief. However, when I will give you a fungal medication, I would want you to use it for the duration of 21 days. So they start feeling that the steroid is better than the medication we are giving them, which shows this problem in the treatment of the cases.
Topical steroids, what else are they used for? Whitening or lightening of the skin. And that is a prevalent cultural issue that we face in India as well. Do you see that in your practice, that people want to lighten their skin? They have misused steroids for that?
The obsession for white skin. And that leads to people using these triple combination creams, which usually contain a steroid and another very popular element known as hydroquinone. Now, hydroquinone, if used correctly under the supervision of a dermatologist, can work for your benefit. But when it is misused, it can actually lead to a major skin problem which is very difficult to treat. And we see a lot of these patients who have been using these fairness creams, which are a combination of the steroid with this hydroquinone, which leads to not only thinning of your skin, but an ashy kind of dermatosis, which gives you this gray skin look. And by the time they come to you, the damage is actually to such an extent that it's almost impossible to repair it completely.
Okay.
So the barrier of the skin is lost because your steroid is thinning your skin. And over time, it's also over-sensitizing you to the sun. So more than the benefit, it's actually causing you more damage because you're getting more prone to UV damage when you're using steroid long-term on the face.
Well, Dr. Kohli, the tropical climate that we have, we're probably seeing one of the hottest summers right now in India as well. How does that affect skin health, and what are the key problems which impact Indian skin? It's not only the heat, it's not only the tropical climate, but also air pollution.
Yes. So I think it's what you rightly said, and even in your introduction, the skin is your largest organ and it is your first line of defense. So when you are exposed to an environment where there is such high humidity and such poor AI index, your skin is going to be absorbing a lot more dust and grime which will deposit. So if you don't have a healthy skincare regime to ensure that that grime is wiped off your skin, there is going to be clogging of pores, which leads to the increased incidence of acne. Tropical climate, as I said before, can lead to a lot of issues like truncal acne. It can also cause an increased incidence of fungal infections and certain other bacterial infections as well, which are your hair root infections because of the increased friction with sweat and clothes. So these conditions are all seen more in a tropical environment. However, I feel that with the Indian genotype, what has changed is also poor dietary choices. And that has played a pivotal role in the increase of incidence of acne even in adults. And acne is no longer a teenage problem. Now you see a lot more cases of adult acne. And I think that's a lot to do with your lifestyle choices as well as the diet.
Okay, so what do you recommend to us Indians to prevent these kind of skin issues who live in tropical climates, who face the sun and the heat and the air pollution and the grit and the grime every day?
I think one thing which I would like to mention very importantly is that I recommend a double cleansing method, which is using a micellar water prior to your face wash to help clean your skin thoroughly, because the micellar water is acting like a magnet to pull out all the dust which is getting stuck in your pores, which might not be visible to a naked eye. Secondly, because of the environment, using wide-rimmed hats, bigger sunglasses, wearing physical clothing to protect you from the sun is as important as using a sunscreen. And be a well-read consumer. So choose a sunscreen which not only shows you your SPF, but also shows you your protection against the pigment damage. And lastly, but very importantly, concentrating on your diet. So eating an omega-rich diet is very beneficial for the skin, along with adding as many antioxidants, including berries, that you can to your diet. So I always say eat a rainbow diet. So as many colors on the plate, the more bright your skin is.
If you are a 40-year-old man and you're traveling by the train and you're still exposed to all of these issues, what would you recommend to him?
I think the one basic thing which I feel, in my opinion, is non-negotiable is use a sunscreen and ensure that you at least cleanse your skin twice. So once you get off, then if you can't do the double cleansing, at least using the right cleanser which is suited for your skin type alone can be. See, a lot of people just use any random soap. Now that might disturb the pH of your skin and worsen your skin further. And I think diet is something everyone can incorporate, irrespective of whether it's an urbanized population or not. So making healthy dietary choices and going back to your roots and eating seasonal vegetables alone can actually help build your immunity against the sun.
Well, Dr. Kohli, you also mentioned besides acne, one of the key issues that we are now facing is hair loss. We're also seeing hair loss in the younger population, men and women. What is the reason for that?
So in some cases, when you have a hair loss pattern which is genetic, that is of course controlled by your lineage, right? But a lot of the younger patients nowadays suffer from acute hair loss, which is onset because of crash diets. See, a lot of these popular diet fads are going on and everybody wants to be the fittest version of themselves. But what happens is that sometimes when you follow these diets, you deplete your body of essential amino acids which are required and are the protein building blocks for your good hair or good nails, and for that matter even for collagen of your skin. When we go on these diets without the correct supplementation, that becomes a major factor. Secondly, the overusage of chemicals. Doing a lot of hair treatments can weaken the bonds of your hair and lead to a lot of breakages. And I think another factor which we cannot overlook is, of course, the environmental factors, that the water which is also available for a lot of us does contain a lot of hydroxylates, which are harmful for the scalp. And there is a lot of shifting, you're shifting from one city to the other, your environment is changing, your water is changing, which can also trigger hair loss. So up and above, I think in the younger age group, we are seeing hair loss primarily because of these three factors. And in most cases, there has been a correlation with the depleted iron and B12, which I think gets overlooked because people think that vitamin D, B12 and iron doesn't need to be tested. But if you go to see, these are primary factors for your hair loss.
Okay. Are we seeing an increased risk of skin cancer in India?
I think because we have higher melanin, in terms of skin cancer, we do have a better protection. However, with the popular trends of sunbathing, more summer holidays, people being out and about more, I think there has been a rise, but I still wouldn't compare it to a Caucasian skin. I still think that Indians are safer in that aspect.
The other condition which I wanted to touch upon is moles and warts. Some people are born with it. What would you recommend to them when they are born with it? And what do you recommend to somebody who sees it come up one fine day?
Ekta, I'm very glad we're discussing this because I think warts is a term which is used completely wrong. We need to understand that warts is a viral infection and it's a morphological condition which can be treated and should be treated. Moles are what you could be born with or you could develop with your age depending upon your genetic predisposition. Now, when you have warts, they need treatment because it's a viral infection. So they should be looked at like a viral infection and be treated. Many people confuse skin tags as warts. So when you see skin tags on your neck, those are not warts. Those are skin tags and they are benign usually until unless you see one of them suddenly grow or change in shape, then you should immediately get it to be seen by a dermatologist to make sure there is nothing to worry about. But in terms of moles, what you are born with, there are lasers today which are available, but it really depends on the depth of your mole. Some of them cannot be removed and might need a surgical intervention to completely get rid of. So I feel that using these home remedies, I think a commonly thing done in India is that a horse tail hair is tied to cut these skin tags. Some people apply lime. I would highly recommend that people stay away from these things because these will lead to chemical burns rather than actually getting rid of the problem.
Okay, all right. So warts need to be treated right away and moles can be surgically treated. What if,
or with laser. And moles is more aesthetic. It's a more aesthetic concern. So if it's bothering you, you can have it treated or your skin tags also. If it's aesthetically bothering you, it can be treated. But warts is something which is a non-negotiable thing. It needs to be treated because they will spread.
So if you see, an abrasion come up on your skin later on in life, it's a wart and not a mole.
No, moles can also appear later, but I think that you should leave for the dermatologist to decide because it's upon the appearance of the lesion, whether it's a wart. It needs to be checked, yes.
Okay, all right. So that's the important part of it. We have a lot more questions on skin health. We'll take a break and be back. Welcome back to the show where we are discussing skin health. Dr. Kohli, how expensive or affordable are these aesthetic treatments?
So I think it's such a plethora that you can choose from that I feel it would be right to say that there is a treatment which is available for all budgets. Medifacials could be as basic as starting from anywhere, let's say up to from 1500 rupees as well. There are certain basic facials which you can start. They might not have all the steps, but the basic exfoliation will still be achieved. And I think this just small shift or where people have started realizing that they don't need to go to a next door salon but they have that available under the supervision of a dermatologist and by someone who's trained to know your skin and identify your problems, I think that in itself has been a huge shift. So it's a paradigm shift in your thinking. And people believing that aesthetic treatments are not only for a certain strata of society but available for everybody, and it's not a thing only celebrities do. Now even a common person wants to look good, and it's become very preventive in that aspect.
Okay. What are the precautions one needs to take?
Post a procedure?
Pre-procedure, deciding on the skin aesthetic.
So, honestly, before a procedure, there aren't any major precautions. But the only thing that I would like to point out is that if you are using an active ingredient, which means like a retinol or a benzoyl peroxide, which you could be using for your acne or anti-aging, that needs to be stopped at least 24 to 48 hours before you come in for any skin treatment, whether it's a laser or it's a chemical peel, because your skin is a little more sensitized, so you might react. So these active ingredient products should be stopped.
Okay, well, we just have a couple of rapid fire questions, so I'm just going to shoot them at you. I request if you could just keep your answers to 1 or 2 words if possible, or maybe 2 sentences if possible. Dr. Kohli, let me start with you. Good tips for good skin health.
A good diet and sunscreen.
Okay, Dr. Kohli, good tips for hair health.
Take good amino acid supplements and take biotin only if it's needed. And if you live in a city which might have excessive hydroxylates in the water, you can use a shower head to help.
Okay. Dr. Kohli, how much water should one drink?
It honestly depends on your lifestyle. For an athlete, you would need much more, and for a kidney patient, you would need much less. But on an average, for anyone who weighs above 50 kg, make sure you're consuming about 8 to 12 glasses of water, which is about 2 to 2.5 liters.
Best makeup brand to use? And these are questions which I've got from other people.
I usually recommend any product which is dermatologically researched. So I think in that aspect, I would go by Bobbi Brown and Clinique. I think they are one of the popular brands, and even Charlotte Tilbury.
All right, Dr. Kohli, it's been a pleasure. Thank you very much for joining in and speaking with us about skin health. Thanks very much.